Hello, everyone. My name is Vasti Pierre, and today I'll be presenting on ethical and policy factors in healthcare coordination. This presentation discusses the ways in which healthcare policy and ethics can affect care coordination of healthcare organizations. Care coordination is an important role of nursing because it focuses on continuity, safety, and quality of care provided to the patient across the continuum of care. Coordination, however, is not a solitary process. It is influenced by healthcare policies, regulatory standards, and professional ethical models. Nurses should be aware of the role that government policies play in determining the access to care, funding, safety standards, and quality reporting. Simultaneously, we should support ethical values, including patient autonomy, justice, beneficence, and non maleficence. Professional ethical standards help nurses to make decisions when there are limitations or conflicts in the policies. This presentation will discuss the effects of healthcare policies and specifically the Affordable Care Act on care coordination, ethical dilemma due to policy provisions, and how Nursing Code of Ethics contributes to fair, patient focused coordination. There are four key objectives to be discussed in this presentation. To begin with, I will describe how healthcare policies by the government affect coordination of care in healthcare organizations and communities. Policies dictate the sources of funds, insurance provisions, access of preventive care, and quality standards that directly influence the systems of nursing coordination of services. Secondly, I will discuss ethical dilemmas that occur when the provisions of policy lead to the clash between patient needs and organizational or financial limits. Third, I will determine how the Nursing Code of Ethics affects the decision on care coordination. Ethical guidance will make nurses advocate and be fair even in the case of policy constraints. Lastly, I will examine the evidence provided by the academic study that ethical care with good coordination results in better patient outcomes, less readmission, and increased efficiency of the healthcare system. Knowing these parts jointly, nurses will support safe, equitable, and policy compliant care and specifications that qualify them as strong advocates and leaders. Scope of care coordination entails the provision of smooth healthcare services to patients in a variety of settings and providers. In the absence of coordination, patients usually receive disjointed care, redundancy of services, drug errors, as well as service inefficiencies among providers. A high level of coordination enhances patient outcomes because it provides timely follow up appointments, medication reconciliation, and proper referrals. Studies have established that coordinated care can greatly help to curb hospital readmissions, especially in the case of chronic patients. It also enhances safety of patients by reducing some of the complications and adverse events that can be avoided. The key component in coordination is the interdisciplinary collaboration. Nurses are the intermediaries between the physicians, social workers, case managers, and the community agencies. This team approach promotes holistic care, which includes medical, psychosocial, and environmental issues. The care coordination also enhances patient engagement as the patients are informed about their treatment plans and discharge instructions. Finally, coordination promotes health centered care because it aligns healthcare services with patient values, preferences, and needs along the continuum of care. Policies of the government influence the healthcare sector by providing funding, regulation levels, and insurance cover requirements. Such policies determine how patients are able to receive preventative care, specialty, or community based services. As an illustration, the Affordable Care Act has increased the health insurance cover and mandated numerous preventative care to be extended without cost sharing. Policies facilitate the early diagnosis and prevention of disease by improving access, enhancing care coordination. Policies also introduce standards of safety and quality that healthcare entities should comply with to ensure that they are accredited and eligible to receive reimbursement. The requirements promote the development of the structured care coordination programs, discharge planning protocols, and quality reporting systems by organizations. Yet, administrative work and financial strains can also be augmented by policy requirements. Thus, medical administrators and nurses should strike a balance between compliance and patient interests. The awareness of policy frameworks enables nurses to foresee the system's level obstacles and promote to achieve better access and equitable healthcare delivery. The Affordable Care Act, which was signed in 2010, has led to a drastic change in the healthcare delivery in the United States. It increased insurance coverage by expanding the Medicaid and insurance marketplaces, which decreased the number of uninsured. The ACA also enhanced the accessibility of primary and preventive care to the patients through coverage, which enhanced the care coordination within the healthcare setting. Another policy that contributed to the coordinated care models, like accountable care organizations that focus on quality improvement and cost efficiency, was encouraged. These types of models encourage teamwork between providers and minimize fragmentation. Significantly, ACA solved the problem of health disparities by increasing access to low-income groups. Nonetheless, the adoption of ACA provisions demanded healthcare organizations to modify their reporting standards, quality standards, and the structure of reimbursement. The role of nurses entails compliance and patient advocacy. Despite the expansion of policies, inequalities persist to show that ethical leadership is required in maintaining equitable practices and care coordination. Ethical tensions are sometimes generated by healthcare policies. As an illustration, a small budget for the lack of personnel can inhibit the services that the patients can access. Moral distress may be witnessed among nurses when they have resources that cannot permit them to provide the best care. Restrictions under insurance may constrain the treatment and the dilemma that arises in between the clinically prescribed and the financially approved treatment. The other dilemma is between the cost containment initiatives and quality improvement objectives. The healthcare institutions are required to be sustainable financially, but nurses have moral responsibilities to ensure the well-being of the patients. Also, the privacy of the patient is secured by confidentiality laws, whereas the patient privacy might be violated in the favor of public health reporting needs. Nurses have to walk a fine line between these competing demands without violating ethical standards, including beneficence, justice, and justice. Professional code of conduct can also guide in such conflicts by focusing on the attribute of patient advocacy, accountability, and professional integrity. Ethical competence assures nurses to act wisely when the policies present complex situations on decision making. The healthcare policy functions at various levels. On a national scale, federal agencies stipulate the financing of healthcare insurance policies and national quality measures. The policies influence the model of reimbursement and eligibility of the patient. On the state level, licensure, scope of practice, and professional standards are regulated through boards of nursing. The Medicaid expansion and public health programs are also affected by state policies. On a local level, the health departments are carrying out community programs whereby they are targeting the needs of particular population, like the vaccination programs or chronic illness management programs. All the levels influence coordination of care among nurses. As an illustration, the ability of local resources will dictate the ability of the patients to receive rehabilitation services or home care programs. Nurses need to be aware of these layers of policies to be able to advocate for patients and referral networks. The best coordination is one that had the policies aligned at all levels to help in promoting equitable access and community health. Professional nursing practice is guided by the Code of Ethics of Nurses, which is designed by the American Nurses Association. It focuses on human dignity, devotion to the patient, advocacy, and responsibility. These principles are used in care coordination to help nurses focus on the rights of patients and equal access to services. Justice demands that nurses must deal with disparities against the sideline populations. Advocacy is done to make sure the vulnerable person gets proper referral, education, and support. The code also mandates nurses work with interdisciplinary teams without being compromised. The code offers a systemic approach to making a decision when the policies pose ethical ambiguity. Nurses can improve patient trust as well as organizational credibility. by ensuring that the policy compliance is in accordance with the ethical standards. Ethical leadership in the care coordination fosters fairness, transparency, and culturally competent care delivery along with healthcare continuum. The issue of health disparities has an immense impact on care coordination. Low-income community patients can either have no means of transportation, no insurance, or no stable residence, making it difficult to receive follow-up care. Rural communities tend to have poor access to specialty care or emergency services. Differences in culture and language may lead to barriers in communication, which may lower the level of treatment adherence. In organizing care plans, nurses need to examine social determinants of health. To overcome these determinants, it might be necessary to cooperate with social workers, community agencies, and public health programs. Ethical coordination entails equal treatment and culturally sensitive strategies that consider the values and beliefs of the patients. Studies show that social determinants can be tackled to result in better health and fewer avoidable hospital admissions. Thus, the care coordination goes beyond clinical care and involves support of environmental and socioeconomic factors of health. The need to have ethical and coordinated care is evidenced. Research indicates that the coordination of care leads to reduced readmission of hospitals and increased patient satisfaction. Prevention saves on the long-term healthcare expenses. Ethical leadership in the organizations improves the quality output and improves patient-provider relationships. There is no doubt that academic studies advocate the benefit of ethically based and coordinated care. Research indicates that well-designed care coordination initiatives will increase rehospitalization and enhance chronic disease self-management. Preventive care programs decrease the overall healthcare spending in the long run as they treat conditions at an early stage. Ethical leadership builds trust between the patients and the providers, enhancing satisfaction and treatment adherence. There is also evidence that coordinated care models improve the interdisciplinary communication and patient safety outcomes. Healthcare organizations with emphasis on ethical practices and compliance to policies are showing better quality measures and less adverse events. These results support the need to incorporate the ethical frameworks in the policy-based coordination strategies. To sum up, healthcare policies and ethical standards play an important role in the coordination of care. Nurses are at the center of steering such policies without compromising ethical standards. Knowledge of policy frameworks can help in patient advocacy as well as healthcare outcomes. Ethical care coordination eventually enhances the healthcare systems and fosters equality of access to care. Thank you for watching. Please refer to the references below. Have a great day.